all for your great support and making sure that we're able to kind of manage this well. Everybody, thank you all for joining us. We're looking forward to the conversation that we're going to have today. I'm so excited to be here with my partner in this endeavor, Dorothy Chaney, who really worked to try to make sure that we created a session that would allow for us to be able to have kind of a meeting and deep dive into the conversations around these two domains that we're going to speak to today. One of the things that I wanted to do and make sure that we were able to discuss was to think of a way of framing these webinars that we're having here. I think for me, it's helpful to think about them in terms of it being like study hall. And a study hall for us. It's just an opportunity. We're looking to try to share some insights, some thoughts that we have. The things that we're going to present may not be exhaustive with respect to the topical areas that we're going to be speaking to, but they're not intended to do that. They're intended to provide an opportunity for those of you who we know, if you're participating in this, it's because you've been engaging in this work of prevention and the application of prevention science, at least long enough to consider looking at trying to achieve certification in this. And so this is not intended to introduce these topics, but rather to talk about these topics in a way that might help your preparations in that pursuit. And to that end, we're asking you guys to make sure you get out of this session what you want and need to get out of the session. So utilize the chat, reach out and engage. Myself and our great team there at the Southeast Prevention Technology Transfer Center, we're going to be monitoring the chat throughout all of this. Make sure if you have questions or thoughts or insights, and make sure you can engage with each other even during and utilizing the chat in that way. The more we have a conversation around these things, the more you bring out the things that you have some questions about, the more that we're going to be able to apply and align our content and our delivery to your needs. And so with that, I'm extraordinarily grateful to have Dorothy with us again to lead us in this conversation. She is a remarkable friend, but she's also just a remarkable human being. I appreciate you, Dorothy. Dorothy, I'm going to turn the mic over to you and looking forward to the conversation.
Awesome. It's okay, Ashley, if you're not feeling well that you're off camera. So I'm just going to say the bar is pretty high today because we did session 1 and it was a fantastic exchange of ideas and great conversations. So I'm expecting the same today. And so one of the things that Carlton and I really like to do, especially when we're doing virtual training, is this is not one of those things where you just, mute and turn your camera off and go put the pot roast in. This is really an opportunity for us to have a conversation about this. And like Carlton said, so I love that we're doing these sessions because what I really love is our field and the science of prevention, which is still a pretty new science, but there's a lot of really important skills that we pick up as we hone our craft and as we work in more and more communities and we get deeper into the work. And so this discussion about getting ready for the Certified Prevention Specialist exam it's great because we have to study because there's a test, but it's also a great opportunity for us to reflect on the key elements that make us effective community problem solvers. And so it's sort of those two lenses that I'm looking through as we go through our session today. So here's what we want to do by the end of this session. We want to be able to state the benefits of effective communication and community engagement. Those are the two domains that we're going to be speaking about today, domains 3 and 4. We want to be able to describe the principles of effective verbal and nonverbal communication, identify strategies to engage stakeholders and build partnerships, and explain the role of community organizing in implementing and sustaining prevention strategies. And really, we're not going to teach it, we're going to discuss it together as a group, really. So this is just an overview of the 6 CPS domains. So we did planning and evaluation, as well as prevention, education, and service delivery in our first session. This is our second session. So today we're looking at communication and community organizing. And then our third session will take care of the last 2 domains. So we're going to just do some quick introduction for the session. We're going to then do domain 3. We're going to do a little bit of a self-assessment. We did a breakout last time, and it was sometimes the technology gets in the way of the activity. So we're not going to do any breakouts, but we are going to give an opportunity for a self-assessment that we will then have a chance to talk about. Then we'll go through some of the content, a tiny little scenario to discuss, and then we'll give you some sample questions. And then we'll do the same for domain 4. So that's the roadmap for the day: a self-assessment, a little overview of some of the key elements within the domain, sample questions, and a little scenario. So in domain 3, this is what we'll be talking about: media literacy, advocacy, and social marketing. I'm also going to give you a little tiny overview of domain 3 because they made some recent, 2013 changes to it based on sort of the way that social marketing and social media has really informed our work. Talking about communication models, effective listening, public speaking, facilitation skills, and communication skills. And I think it's great that we're doing domain 3 because we really want you to engage so you can practice your public speaking, your facilitation. So this is a practice opportunity for you today as you're going to be sharing as we go through. And then we're going to do domain 4, which is community organization. And, I still have a lot of people that don't have a clue what I do for a living. I don't know. It's just so difficult to explain what we do as preventionists. But I always say we're one part community organizing, one part public health science. And I love that we're going to spend a little bit of time talking about community organizing, and that's domain 4. So we're going to talk a little bit about recruiting and engaging stakeholders, collaboration and integration, and then some of the strategies to build ownership and provide TA, which is technical assistance. And in this piece, we're going to talk a little bit about training and technical assistance. One of the things that I have learned over the years when it comes to community organizing is it's essential that we give our communities the tools before we give them the task. And that's what this session is going to talk about, is how do we equip our communities with the tools so that we can be effective. So let's get started. Let's start with domain 3. So what is domain 3? It focuses on prevention communication skills. It includes cultural competence, media literacy, and advocacy. Although cultural competence really is woven into all of the domains. It covers public speaking, writing, and messaging with data. And it's really, really important that we understand the role of communication, and we really are strategic and intentional about how we communicate with our coalitions, with our communities, in order for us to move the needle on the issues that we're working in our community. So it was introduced by the ICNRC in 2013 in response to evolving media and communication demands. And it really was expanded beyond traditional media to include things like health literacy and social marketing and framing our messages, because really that strategic communication and prevention is key for behavior change. So why does communication matter? Well, it really does bridge the gap between data and action. And when we're looking at data, and when I'm doing evaluation with communities, I'll say, your data really is a story. And so understanding the importance of communication helps us frame the data so that we tell the story in our communities. It also helps shape public perception of risk and protective factors. And it ultimately influences decision makers and policy when we think about policy, systems, and environmental change. And it also is a really important contributing factor that enhances coalition building and engaging our stakeholders. So communication is really at the heart of all the work that we do. So we're going to begin with a quick self-assessment. And so we're going to give you a few moments to complete the self-assessment. I'm going to bring up the next slide, that you can either look at it from the slide, but I also believe that the handout is going to be put in the chat box. But write down a couple of examples where you have illustrated competencies as you complete the assessment. So the instructions are rating from 1 to 4. 1 is not very confident to 4 being very confident. And I'm going to give you really a few minutes to complete this. I'm going to go through it again too and rate myself so that we can all have the conversation. Carlton, is it possible to see this? Are you able to see it?
Yes, we can see, and everyone in WebEx, at least on my screen, right above the slide area on my screen, there's an opportunity to either increase or decrease the size of the slide, the panel that you're looking at. And so if I hit the plus button, I can increase it so that I can read it better. And
Awesome.
Amber has also put a Google link into the chat that gives you also access to the document as well.
Awesome.
Please indicate if you have any issue with accessing this at all. And so, Dorothy, you just want folks to just kind of take an opportunity to kind of go through, look at each of the questions, and try to answer it for themselves.
Yes, that's it. This is just an opportunity for you to self-reflect, and then when everyone's finished, so it'll be, if you want to turn your camera off for a minute and we're completed, absolutely. But this is just a chance for your own self-reflection on some of these, and then we're going to come back and we're going to talk about it.
Dorothy, I'm noticing that this slide says the community organization self-assessment.
Oh my goodness. I'm sorry. This is the, I'm going to stop sharing for a second. I got the worksheets mixed up. Oh, my bad.
Thank you. Sorry about this, guys. Just give us just one moment. And Amber, if you could put the other one in the chat now. There's a communication self-assessment.
Oh my gosh. Good call, Carlton. So sorry about that, guys.
Perfect. Thank you for your patience, guys.
Good catch, Carlton.
I got Dion work in my ear saying that's what friends are for. Keep smiling, keep shining. We're just going to keep on keeping on. Dorothy, you got it, or do you need me to do it?
Yeah, it's the formatting screwed up on me here.
It's okay.
No, I'm gonna get you to do it, Carlton, because oh no, I think we can. It just looks different on this one. Okay. There we go.
Perfect. The questions are the same. Don't worry about the way it looks, guys.
Sorry, I'm so sorry about that, you guys.
All right. So because we're talking about communications now in this part of this of the webinar, we're wanting you to do this the communication self-assessment.
And as you're going through this, sorry about that snafu. As you're going through this, I really would love it if you can think of any examples of a time when you really felt confident in one of these areas. Ashley, is you raise your hand?
I, I, think, I think I missed where you guys said where to document the answers.
you can just if you're doing it off the screen, you can just write it down on a piece of paper, or you can download the handout that
Gotcha.
was put in the chat.
Yeah,
Okay.
just when you
I
use
just
it to jot it down yourself.
gotcha. I just didn't know if you guys wanted to see it in real time. Thank you.
No, this is for you. This is a self-assessment. So this is just for your own reflection. Thank you, Ashley. Really good question.
And again, folks, WebEx has this very, very cool aspect that you can increase the size of the slide on your screen. Looking just above the screen, you'll note where you're able to kind of increase the size.
Awesome. All right, I see some folks are so if you've gone through, we would love to see, I would love to hear from you where you feel that you're really confident. More confident in social media now, Lee. Amanda said, I feel confident tailoring to different groups as I have worked in multiple fields and enjoy helping them understand prevention from their sector lens. I think that's brilliant. You know, it was interesting when we started this session, our first session, our question was, what field did you come from? And I think that's one of the things that makes prevention so rich and full, is that we bring together so many different perspectives in different fields as we come to prevention. And every one of our perspectives is really important, and it helps us then connect with those sectors. Lots of stuff going on in the chat box. Ashley said, I feel confident in public speaking. Can I tell you, I did Toastmasters, Carlton, when I was in high school, and I was too shy to finish it. And then it became a flight attendant, and I'd only flown once. And so after 10 years of people staring at me for 10 hours of the day, I now could speak in front of a group. But that is a skill, Ashley, being confident. Alex, using data to support messaging. Yeah. I love that. Data is a story. I'm comfortable speaking in front of various audiences. And that, Lynn, that's a really important skill, because the way we communicate is going to be different depending on what that audience is. Debbie says, I feel confident in tailoring written materials that are appropriate to different audiences. You guys are knocking this out of the park. I'm confident in social media, creating material for different people. Oh, Hannah, you create content for youth and young adults on social media, different handouts and flyers. Would love to learn more about advocacy and policy. What I love, Hannah, is that you identified something that's really important. When we're crafting messages, the messages are going to be very different depending on what the audience is, how we reach them. I can tell you my 19 and 20-year-old are not on Facebook, but 57-year-old mom is.
Dorothy,
Charlotte.
Dorothy, one of the things that I love about this is the opportunity that, because of the way you have this laid out, we don't often think about it as these separate kind of skills, that because I'm seeing this kind of variety of things that folks feel confident in. Some folks feel great in social media, while others feel great with utilizing data, while others are great public speakers. But this is really wonderful, a kind of a wonderful opportunity of kind of looking at all these skill sets that are important to our field.
You know, the other thing that stands out to me as I look at this is I think about that one about, for example, comfortable speaking in front of various audiences. And one of the things that's so important as I think about domain 3 and domain 4 is that we need to have these skills, but it may not be us that are the ones that are speaking in front of the policymakers, for example. We may be, Hannah, you talked about working with youth. You may be supporting and training your youth for them to have the confidence to also, you know, build those skills and communicate. And that's the power of coalitions, is we need to have these skills, and then we work to empower and engage our community in it. Ben says, I'm able to use plain language with my, love that. And that really goes to health literacy. So Jennifer, I love that. You're confident speaking to audiences, but need to improve use of social media. And again, this is a really great, when we're looking at this domain, there's elements exactly where we're going to be strong and where we can sort of hone. Love it. All right, well, let's dive in a little bit to the domain. And again, sorry that I put up the wrong self-assessment, but thanks for doing it. So the first piece that we're looking at when we're looking at communication is communication models. And so when we're thinking about communicating, it's really about sending and receiving messages. I'm going to tell you, as a trainer, one of the things that I have to constantly work on is my listening skills, because that is just where, because and I was reviewing this and reading this, like, this is really helpful. I know the importance of listening, but that's a skill that I still have to work. And when I'm a trainer, I'm going to real talk here. When I'm a trainer, we've got 2 hours in a session, and somebody is asking me a question, and I know where the question is going. It takes everything in me to not stop and go, oh, I know what you're asking, so I can keep the train moving on time. But I really need to be present and listen to the question, even if I know where the question is going. And so listening to me is, because people need to feel heard no matter what it is. So that sender receiver model is so important, to be an active listener and when you're communicating, and that communication is two-way. So even when we're trying to convince our communities using data and stories that there's an issue in the community, we also have to listen to the perspectives in the community as well, and the cultural context. So critically important, understanding that there are so many different aspects to all of our communities. Even the communities that may look like they're homogeneous, there's no such thing as a homogeneous community. There's diversity in so many ways, and different cultural norms and values and beliefs. And so we need to listen and understand, and also reflect that in our communication skills. So I'm going to tell you, domain 3, I need to listen more. That's one that I am probably only a 2 on a scale of 1 to 4. Media literacy is also really important. And so how have you ever used media literacy? And media literacy is about analyzing media messages and tailoring content to people's diverse perspectives. So has anyone ever used media literacy or done media literacy trainings? Would love to hear how you've used media literacy.
Raise your hand if you want to unmute and share your experience. Kevin, and then Tyra.
Yeah. So we actually just completed a training. It was a week-long intensive training on exactly this, on like media messaging, media literacy for prevention. So it's had us really take stock in the kind of messaging we do have about our coalitions and the messaging we're putting out, and are people seeing it, and is it relevant, and all of these kinds of things. Is it having the kind of impact that we want? And so to that end, as we've taken, asked these kinds of questions, we've implemented a really in-depth research study in our area to be able to see what kind of an impact we're having with our messaging, and whether it's working and whether it's resonating with people or not. Just because we learned just how crucial that is to different communities.
So I love that. Tyra, I'm coming to you. Kevin, thank you for sharing that. I really love that for a couple of reasons. First, when you had me at evaluation, when you said you were evaluating the efficacy, and Kevin, I love evaluation. But the other thing is, as I'm thinking about, this is where I love these conversations when we're getting ready for CPS, because Kevin just described how he is working in media literacy and analyzing. It's part of his work. So when you're studying to the test, he's now got all of that knowledge upon which to draw as he's looking at the answers. And that's what I want all of us to take away from these sessions. Is it's about the test, but it's about our field and your experience, and pulling all that together to inform your CPS exam. So thank you for sharing that, Kevin, and nice to see you. Tyra.
Well, recently they did, I think it was through PTTC, but they had a storytelling training, and I found that one really great, because he kind of talked about how to take the story of our community and its struggles, the things that we're weak in, and how to translate that into messages to connect with your community and share the prevention story, where, what needs to be improved, what's going well, things like that. And I really loved that training. I do feel like social media, I actually used to be a blogger, so I had quite a bit of experience and then took a break. But then I feel like social media changes so much so frequently that I feel like I'm like, okay, I need to redo a bunch of stuff. So I've looked more for trainings that are not necessarily prevention, but just kind of understanding the algorithms and things like that and how to use them and organize some of the newer tools to help with that.
Oh, that's brilliant. That's brilliant. And I think you raise a really good point, Tyra, in that even though it's not specifically focused to prevention, learning the algorithms and how social media works. And I mean, that's going to really help inform framing and being strategic and intentional in reaching your targets with messaging. I love that.
Yeah, to that point,
Yep.
a lot of great stuff is happening in the chat that I'm having a hard time keeping up with. It's coming so fast and frequent. But Jules talking about the fact that translating or making sure that when you're making posts that you're fitting it to the right target audience. Sometimes we put on something that we put on Instagram, for example, for youth is going to be a different message than what we put on Facebook for adults. But the messages are the same, but the way that presenting is different, like saying pictures or adaptations, for example. I understand that completely. I try my best to do a TikTok dance, but I can only post it on Facebook because I don't know how to do. It's so bad. It's so bad. I took our needs assessment results, a very long, wordy document, and created easier to read reports to provide staff and community partners with a summary. That's what Haley mentioned. So a lot of really, really great things are coming in through the chat. Great
Awesome.
example.
Love it. All right, let's now look at media advocacy. So media advocacy really aims to influence health-related decisions. So think about earned media. Think about, this is not paid media, think about earned media, thinking about shaping media coverage on the issues that are really, really important to us as we're working in our fields. So would love to hear, yeah, I'm trying to keep up with the chat too, Carlton. There's so much going on, so many great comments.
Lynn mentions we have to consider someone's level of understanding of the subject matter.
Absolutely, absolutely. So again, so media literacy, media advocacy are really, really important pieces. And again, I love that you have such a knowledge and background in this. Remember, this is what we do. And so as we're getting ready for the CPS exam, some of these concepts, they're part of our day-to-day, sort of the genetic makeup of us as prevention specialists. Social marketing actually uses commercial marketing techniques. So Tyra, when you were talking about taking trainings on understanding social media, you really were drawing from social marketing to inform our field. And we see this over and over again, that we use those marketing techniques to try to change behavior. And we know that from a marketing standpoint, there's a real science to what changes behavior. We can draw upon that to try to change behaviors in our communities with individuals. Would love to hear in the chat box any examples you have of using social marketing.
Dorothy, sometimes I hear the term social marketing and social media being used kind of interchangeably, but that doesn't seem right to me. Can you kind of explain this distinction between how we think about those two things?
Kevin said, I wish I had experience with this. Oh, Amanda, did you just raised your hand?
Yeah, can you hear me?
We can, yes.
Sure. So we received some opioid abatement funding at the county level, and I will be 40 this year, and I recognize my lack of creativity in the social media world. Facebook's great. I love to watch TikTok, but not read TikTok. So or not post on TikTok. We hired a 21-year-old young lady college student who is going to school for digital media marketing. and our social media engagement has increased by 900% since she took over. We now have an Instagram following. So I think for me, it was really recognizing I had the ideas, I knew what it should look like, I knew how to coach, but I could not put it all together. And she also brought a dream to life for me, was a countywide resource guide that she has digital on our brand new website that she learned how to create and created. And then we got them published. So just bringing in someone, knowing where I am not my strongest, and saying, please help me. And she has just blown it out of the water. So I'm
love
really
that.
thankful for that.
I love that. I love that because we don't have to be the expert in everything. That's the power of coalitions, and we can bring in experts to help us where we need a little bit of shoring up. And I love that. I mean, I'm 57 and I don't speak the language of the young people, although I think I do. I don't. I met a young girl. I was doing a training. This is so embarrassing. I was doing a training and I met a girl who goes to the same university as my daughter. And I said, oh, I can connect you two on Instacart. No. I'm turning around. It's like, I know. I told my daughters, they're like, Mom, you didn't yet. No, I'm not.
Don't stop laughing at her, Kevin.
So social media versus social marketing, those are two really important pieces. Social media, we have to be in the spaces, right? We have to be in TikTok, Facebook. We need to be out there. We need to brand and recognize. Marketing is taking it and moving it into behavior change, into a call to action. Think about how when you're watching commercials for snack food, all of a sudden now you want to go, eat a snack. It's that call to action. It's moving behavior change. And we see more and more that coalitions, and you guys all described how you brought in experts with expertise in these areas, that we can actually use those marketing techniques for behavior change. And a really powerful example of social marketing is social norming. And so more and more we see communities that are saying, do you know it's not the norm that 15-year-olds are drinking, that 68% of teenagers are making healthy choices on the weekends. Those are examples of how we can use those marketing techniques for behavior change. And I love the social norming campaigns that so many communities are doing, which is moving people to action in a positive way. Critically important to our work.
Well, thank you, Dorothy. So the distinctions between social media, social marketing, and social norming, sometimes when we view it in a test, they all kind of seem similar. They have relationship, but they are different.
Right. Yep. And I think when we're looking at the CPS exam, that's what's really important in reading the question so that you can really see discerning what it is. Because I was doing some practice questions. I was sharing that with the team before we started. And there's sometimes you just really need to read them a couple of times really well and then go with your gut. Then communication is effective listening skills. And our very first one was communication techniques, and listening is in that, but listening is also pulled out as its own skill as well. And so thinking about being an active listener, and I shared in full disclosure, this is my area of weakness as a trainer, is I really need to be very, very focused on being an active listener. And it's so important in our field to really listen to understand. And so that's really an important piece of our work, is that active listening piece. And I'm going to say, when sometimes in this work, we are going to come up against people that have very different viewpoints than us. And I think it's so important, especially in those moments when people are, giving us a different perspective, that we are so active in listening so that they really understand that we're hearing their perspective, even if our data are telling a different story. Public speaking. So y'all could be facilitating this webinar, because I think most of you said that you were really confident public speaking. And I'm going to tell you, I'm a little envious, because that's not a natural skill for me. I've had to hone it for a long, long time. But it's a critically important skill for us, is to use clear, tailored messages to speak with purpose. And I think maybe that's why y'all are so good at public speaking, is that this feel this work is so important. It's part of our purpose, and it's easy to speak about things that we feel confident in or passionate about. But Ashley says, I'm a natural performer. I was supposed to be in Hollywood. I love that.
Beautiful.
I love it. So public speaking. So I would love to hear, how do you use public speaking? A lot of you said that you are confident. I would love to hear just some examples of how you have honed in your public speaking or how you use public speaking in the work that you do. Ashley.
All right, I'll go. Hey everyone.
Yay.
Again, sorry I'm off camera.
Good.
I use like my public speaking, of course, to work with youth and young adults and try my best to facilitate conversations with them about substance misuse and abuse and try to help them get organized so that they can create healthier and more beautiful communities for them to live and thrive in. And I do it in a way, of course, like that's the public health thing. That's like one of the rule of thumbs in public health. When you communicate, you meet that person where they are.
Love that.
You don't talk to like a person like you would, like somebody in the community, like you would a colleague.
Yeah.
So you give it to them in a way they can understand. And sometimes in talking to the kids, I gotta get down to their level. And it's not cute sometimes. I'm almost 40. It's not cute sometimes, but sometimes you gotta get down there and bully them. You gotta bully them, like, oh, so you think doing drugs is cute? It's cute to you? So you wanna be a, you wanna be a crackhead. So you think being a crackhead is cute? They and they're like, you know what? So right, Miss Ashley, you right. We're not gonna do that. Like you have to meet them where they are. And it's meant to be funny to engage them. But that's how I essentially use my public speaking. I use it more to facilitate a conversation as opposed to talking at someone.
I
Because
love
you
that.
get more out of them when you have a conversation as opposed to this is what a drug is. This is how a drug affects your brain. All right, I told y'all everything. Bye, y'all.
Yeah, love it.
Beautiful.
Thank you, Ashley. I love that. And the so many comments coming in. One of them said, "Know your audience," and I think you described that. So know your audience and what those appropriate messages are. Katie, you taught public speaking to high school. Kevin, you said you teach youth coalitions basic principles on public speaking. I think that's amazing and so powerful when we go back thinking about tailoring messages to different audiences. There is nothing quite so powerful, Carlton Hall, than giving youth the tools to public speak, and then they're framing the messages in front of the leaders. I love that.
Absolutely.
Tyra said you got the school to do a part of the a project, a game presentation at the athletic session. I love that. So you're teaching in community trainings, speak your passion. I love that, Belinda. It sounds like a lot of you do speaking with youth or to families and in schools. Amazing. It's a huge part of the work that we do. Absolutely. Ooh, I love that, Amy. Keep it simple. Don't overload the audience. Brilliant. Yeah. Yep. Really good. Love it. Lots of public speaking. And so actually you talked a little bit about this, make it relatable and share stories. I love that, Amy. And the power of story is really important, especially when you're public speaking. It's not just about sharing the data and what's happening in our communities, but making it real by sharing stories. That can be really powerful. And then also facilitation skills. And so you guys really described that as you were talking about public speaking. It's not speaking at someone, it's equipping people with the tools, it's facilitating the conversation, it's listening, and it's putting all of those pieces together so that you are sharing and you're also encouraging others to share as well. All right, so to wrap this domain up real quick, a prevention organization is implementing a youth-focused multimedia campaign to promote the harms from vaping. Which two knowledge-based skills would be most important that we just talked about? Communication models, media literacy, media advocacy, social marketing, public speaking, facilitation skills, effective listening. All of them are important, but which two would you pick and why? And Claudia, yes, presentations, not slides, need to be simple. Absolutely. So if you're doing a youth-focused, effective listening, love that. Social marketing, so love that. So social marketing is you're moving people to behavior change. I think we've got effective listening and social marketing. Anybody want to come off mute and tell me how you would approach it? Which two? I love the media literacy too.
Yeah.
Love that.
Hi, I'm sorry for my tardiness, but I'm here and I'm also not on camera, sorry.
You're fine.
That's okay.
But the effective listening and also the facilitation skills, because if you're not using effective facilitating skills and you're just talking, it becomes one, and
Sure.
you lose your entire audience, you know. And so when utilizing your effective facilitating skills, then that also allows your audience to hone in on their listening skills, because they're interested in what you're saying, they're watching you, you're engaging them. So, but also you're listening, you're using your listening skills too, to see your audience and to hear what they are saying, not just listen to speak or respond, but listen to really hear what they're saying. Those are the two things that I would focus on.
Love it. And that's brilliant. I love it. Thank you so much for sharing. Yeah, those are really great points. Someone else said, props and more props. Like to be visual. Social marketing, go where they are. I think that's really important too. And then somebody said, I love it. And it came in so fast. You have to know, Esther, you have to know when you've said enough. That's really good too.
My dad used to say the mind can't retain any more than the rear end can endure.
I love it. Awesome. All right, let's do some practice questions. All right, this is domain 3. An effective communication technique is to avoid information overload. If individuals or communities receive too much information, they may tend to put up a barrier to new messages. True or false?
The truths are coming in hot and heavy.
The truths are coming in. All right. Let's go to the next one. Which term refers to the strategic use of media to advance a social and or public policy initiative?
Hurry up.
Hold on.
A, media literacy. B, media advocacy. C, social marketing. D, health literacy. This is the one that Carlton referred to earlier. Is they're related, but they're not all the same. Which term refers to the strategic use of media to advance a social and or public policy initiative?
We got a couple of we got some B's and C's coming in. More B's.
It's B, media advocacy. So media advocacy specifically focuses on influencing public policy and opinion through media channels. All right, I know the answers are still coming in. All right, 3. Which principle is essential in effective public speaking? A, using jargon to appear professional. B, presenting data with no narrative. C, organizing key points logically and using storytelling. D, speaking as quickly as possible to cover all the content.
Which is what we're doing.
I know, as I'm speeding up.
All the C's.
All the C's have it, of course.
You can't.
Do as I say, not as I do, as we're like. All right, practice question 4. Active listening involves formulating a response while the speaker is talking, using open body language and paraphrasing what the speaker said, interrupting to clarify immediately, focusing on primarily on preparing questions.
Those are the folks who are putting in B, though.
The bees have it. Active listening is marked by supportive body language and reflections to show understanding. All right, last one for domain 3, and then we go into domain 4. What does social marketing involve in prevention? Distributing printed brochures, expensive television ad campaigns, using marketing concepts to influence community behavior for social good, or lobbying policymakers and individually. Y'all knocking it out of the park. It's using marketing concepts to influence community behavior for social good. So think about social marketing. I always think about those social norming campaigns. All right, any areas of question on domain 3 that you still have questions about? We don't have a lot of time for questions right now, but what I will say is one of the great opportunities that's accompanying these sessions is the study halls that will be happening. So that would be a really great opportunity too, as you go through to attend those study halls and go deeper into domain 3. All right, let's move into community organizing. And you may have already done the self-assessment because I put that in first. All right, so domain 4 is community organization. It really is involving it's bringing your community together. It's mobilizing your community. This area focuses on coalition building, so capacity building, networking, mobilization, also things like cultural humility, sharing power, and strategic planning. So why does community organization matter in prevention work? Well, I have a couple of little criteria, but would love to hear in the chat box. It brings together people closest to the issue. It empowers sustainable change through leadership that's shared, aligns local conditions with evidence-based strategies, and it supports readiness, capacity building, and advocacy. Why else does community organization matter in this work? I love it. It takes a village. It really is. It's the core of coalition work. You can be the most educated prevention specialist with the best data and the best logic model. And goodness knows, and a lot of y'all know how much I love a good logic model. But here's the thing, if you don't have the community, you're not going to get anywhere. It brings everybody to the table. This is it. We all are community organizer. It really is the heart of our work. It's getting stakeholders that are working on similar goals. It allows these stakeholders to work together. Love it. So we're going to do that self-assessment. This is the one that I had first. So I'll give you just a minute to do this self-assessment this time. Bringing the right, I love that, Ashley, no one person or organization can do it all. And not, absolutely. Thank you, Amber. Amber put the Google Doc in the chat box. I'll give you just a minute to do this self-assessment, and then we'll go from there. So this one is about engaging stakeholders, building and sustaining coalitions, identifying readiness and capacity, facilitating meetings that are inclusive, navigating power dynamics and shared leadership. That takes skill, let me tell you. Using local data to guide your work, and developing partnerships across sectors. Would love to know where folks feel most confident. Would love to know where people feel most confident. You can either unmute or you can put it in the chat box. Ben, your 3's all the way down the board. I love that. Developing partnerships. Love that. Engaging stakeholders in community efforts. I love that. So that's so interesting that you guys are also strong in building partnerships. I was thinking, as I was doing it today, I was thinking, you know what? I am good at doing some partnerships, but there's some stakeholders that I always have a challenge really engaging. Developing partnerships. I love that. Using data. Haley said, I feel most confident with identifying capacity readiness using data. I love that. Annette, facilitating meetings, building partnerships. Tammy says, I think I'm the only one who likes data. Oh,
You're not the only one.
girl, no. You are with family here today. I'm just saying. We all love data. But yes, but that could be a challenge, is how do we present data to coalitions when they just want to jump into action and not look at the data? Building coalition, engaging partners, facilitating. They are all relationship building. Yes, they're all relationship building. This is really about
That's a great point.
bringing the community together. Absolutely.
That's a great point.
Love that. Love that. Oh, Debbie says, now that's a good partnership. My partner at work loves data. I love going out into the community. It's a great partnership. That's beautiful. I love that. Mackenzie, local data to guide planning. I love that. And I think that once a community or a coalition sees the power of using data to plan, then it takes the mystery out of using data, and people can see how the data can really not only guide the work, but guide the outcomes that can get them to outcomes. Tracy said, I love seeing the community come together for a common cause. Beautiful. So remember, as you're practicing and getting ready for the CPS, look at all the skills that you already have. You're pulling from that knowledge base as you are getting ready to write for Domain 4, community organizing, for the CPS exam. So there's some key concepts: recruiting and engaging stakeholders in this domain, collaboration and integration, strategies to build ownership, and there's a number of strategies to build ownership that are touched on. So when we think about collaborative leadership and planning, things like asking our questions: who needs to be at the table? What kind of decisions need collaboration? How are conflicting priorities managed or navigated? And then what are the strategies that we're going to involve? Would love to hear any thoughts on how you have illustrated collaborative leadership and planning in your work. And I'm just going to say, one of the things that I've learned along the way is that concept of who comes to the table. Carlton, it took me many years to realize that it's not just one table. It could be many tables. And that part of understanding our communities is that we may have many tables that we go to so that we have a really inclusive environment.
That's beautiful. That's beautiful. I love what Ben said. Ben said key leaders need to be at the table along with your stay-at-home mom or dad.
Yes.
Times have changed dramatically. It will take the whole community to overcome the problems we are facing. Absolutely. Absolutely.
Oh, and I love Mary Rose, focus groups and listening sessions with representatives from all 12 sectors. Many tables, sometimes not so many chairs. You guys are dropping some. You guys are dropping some knowledge.
I'm going to use that. Thank you so much. That's perfect.
All right. So then we move into training, TA, and capacity building. So, and I think, Kevin, you talked about this. Many of you talked about this, doing trainings for your coalitions. You're giving your coalitions, your communities, the tool before you give them the task. So it builds that shared knowledge. And so when you're bringing your communities to the table, they understand that there's a science, there's skills, that there's a method. And it also does support sustainability, because people want to be a part of something that's successful. It also promotes collaboration and continuous learning, sort of that just-in-time training. Not everybody needs to be a certified prevention specialist, but we need to bring the pieces to the community as they need them so they can be effective in the work. Joint training, you guys have described a lot of this. So things like cross-sector learning. So bringing your sectors together and giving that opportunity to facilitate learning among the group and shared perspective. Establishing a common language and shared framework. So we use the strategic prevention framework. Some communities use collective impact or results-based accountability, or trauma-informed care and trauma-responsive approaches. So developing that shared common language and framework is a really important piece of this domain as well. And then onboarding for new coalition members and partners. Technical assistance, or TA, I know when I first got into this field, I didn't know what TA was, but what that really is coaching. It really is coaching and supporting. And so when we're talking about TA, TA is really localized, specific coaching and learning based on where the community is, what it is that they need to know, and helps them sort of be effective in the work that they're doing. We also think about capacity building areas such as strategic planning, policy advocacy, data literacy, equity and inclusion, and systems thinking. All of this goes into that community organization element of the work. So all of this is in domain 4. So let's think about the importance of community organizing and training and all of the pieces that we just talked about, the collaboration, the leadership. How have you used any of these? My question says training, but how have you used any of the elements that we talked about in domain 4 to support your coalition work? Oh, I love that. Debbie said we work with behavioral health and local law enforcement to provide BOTFIN's training in schools, and it's led to a hidden in plain sight trailer. So you're really describing that collaboration, cross-sector collaboration. That's amazing. So that's a really interesting question. Language has changed recently, Astrid, yes, but the work hasn't. We still need to be cognizant of the fact that there's cultures and perspectives and norms and values and disparities that exist in our community. So even though we frame it differently, the work hasn't changed. It just looks a little different, and we talk about it a little bit differently. Ashley says we've done trainings and calls to action. You're a person after my own heart. I love a good call to action. Nora said, last week we coordinated a youth mental health first aid training in collaboration with our health council and regional health department, and were able to recruit teachers and school staff and at a really full room, which was an amazing 8 hours. I love that. We work at schools, churches, community centers. Tyra said, I came in with an almost dead coalition. Oh dear. Reaching out and building collaboration and connections with, that's how it's done. We connect with others and build coalitions. Love it. Love it. Debbie said, that's an example of a whole community working together. Love it. Does anybody feel in domain 4 that there's one skill or one area that you really feel like you need to hone in on as you're getting ready for looking at domain 4 and what we just talked about? Data. Working with the faith-based community, the training to help meet people and have more knowledge. Love it. Beautiful. More data and more community outreach. So as you're going through getting ready, then you can really hone in on those areas where, and there's lots of great practice tests that are out there, and the Southeast PTTC has a lot of really good resources as well. Identifying community readiness. Community readiness is a really important concept. We could spend a whole lot just on community readiness. There's a lot of really good resources online related to identifying community readiness as you're looking at behavior change. Domain 4 also has shared volunteer recruiting and retainment. So this is, and you guys have all described a lot of this, it's really understanding the power of volunteerism in this work, and how shared recruitment leverages coalition partnership and broadens outreach. And a lot of you have talked about how you've built with other coalitions or partnered with other agencies. And really effective retention improves consistency and community trust. So it really is not only recruiting, but it's retaining those volunteers and making sure that you provide an environment where they feel valued. And I always think when I think about volunteer recruitment that nobody can be on all the time. So I think a really important piece of volunteer recruitment and retainment is also saying, you know what, you were really active in Alcohol Awareness Month. You know, if you're taking the summer off, we don't have any expectation you're going to come to the meetings. We'll plug back in the fall, but you'll be involved in our minutes. And I think that's where role descriptions are really important for coalition members too, so that we know when people really need to be active and when they can be a little less active. And that's a really important retainment strategy. So when we're looking at shared volunteer recruiting and retainment, it's really the opportunities to create a volunteer database across partner organizations, coordinating orientation and training opportunities. And you described many, many, many of those training opportunities. Recognizing and celebrating volunteer contributions, ensure those meaningful roles are aligned with community needs, and also, as always, being culturally inclusive and culturally responsive. We'd love to hear from any of you how you do any of this. How do you recognize and celebrate your volunteers, or how do you ensure that there are meaningful roles aligned with your community needs? We'd love to hear from you. There's so much in the chat box. Tyra said, I feel like this is a real hard one in my community, as those interested in volunteer are already maxed out and the rest aren't engaged at all. Yeah, you know, finding people to volunteer is a challenge. And I think that's why we need to use our data. I really love that bullet, aligned with community needs, because we may just be recruiting people to a certain task, not necessarily to come to meetings. Faith-based need to be at the top without the creator at the head of these programs. Love it. Oh, I love that, Claudia. You've got a barbecue event in the summer and a breakfast event in the winter. I love that. Food always makes people happy and brings them together. Appreciation luncheons and other in-person events. Yeah. Understanding the challenges of volunteer recruitment and retaining is a big part of our work. Debbie, you have youth volunteers for Operation Prom and Operation Graduation. We call them ambassadors. I love it. Love that. This also is in domain 4. It's coordinated internal and external communications. So how are we connecting and communicating with our coalition? So effective communication is really essential for planning, trust building, and implementation. Internal communication is really what keeps your coalition members informed and engaged. And how do we do that? We don't want to over email, but we don't want to under connect with them either. And then that external communication strengthens your community support, visibility, and partnerships. And we really talked about that in domain 3. All right, domain 4, little scenario here. 3 organizations in the community have received different funding to address youth substance misuse and mental health issues. What are 2 things that they can do to ensure that they are effective and do not duplicate each other's efforts? So we've got the local school district, we've got a youth empowerment coalition, and the public health department. All have different funding to address youth substance misuse and mental health issues. What are 2 things that they can do? Think about domain 4 and everything we talked about. How could we make sure that they do not duplicate efforts and that they are effective? Bring them together and talk. Absolutely. Collaborate. Oh, I love that one. A lot of really good stuff coming in. So somebody said, I'm going to go back up. There was so much. Form a committee and develop a strategic plan that incorporates all of the objectives. I love that. Put it all together in one plan. Collaborate, communicate, partner with the organizations. Create a coalition and share ideas. Love it. Form a coalition, establish goals, assign tasks, get them together and talk it out. Perfect. And that really is what we do in community organizing, is we bring the community together so that we don't duplicate efforts and that we move forward together. Love it. Brilliant. Lots of good brilliance. All right. Are we ready for some practice questions? Question number 1. Which activity best demonstrates building community ownership in prevention efforts? Delivering a lecture at a community meeting, allowing community members to co-lead decision-making processes, distribute flyers without follow-up, writing grants independently of local input.
A flood of bees.
A flood of bees. The bees have it. Co-leading engages community and shared leadership and decision-making, which is core to domain 4. Number 2, what is the primary purpose of conducting a community readiness assessment? To identify funding sources, to measure knowledge retention rates, to determine how prepared a community is for prevention efforts, or D, to evaluate the success of past programs. And the C's have it. Helps tailor strategies to match your community capacity and stage of mobilization. Love it. Question 3. Which of the following is a key component of a coordinated community coalition? Engaging only health professionals, keeping data and decisions within a single agency, including leaders from multiple community sectors, conducting activities without collaboration. See, yes. So domain 4 really does emphasize that key stakeholder engagement. Thinking of SAMHSA, Substance Abuse Mental Health Services Administration's 12 key sectors. Technical assistance, so TA, in a community organization is used to provide generic fact sheets to community members, offer customized support to improve local planning or implementation, replace the role of local coalition leadership, fund coalition activities without oversight. The B's have it. So TA really supports that tailored coaching that really is going to help increase readiness, give you the skills, and meet cultural needs. Last question in domain 4, community organization. Which communication pattern supports effective community mobilization? Centralized messages from a single leader, open two-way dialogue among coalition partners, silent decision-making committees, unidirectional email blast with no feedback loop. And the B's have it. The B's have it. The B's have it. So these practice questions, and these are all real practice questions. I didn't just make really easy answers. There are some trickier questions. That's not the purpose of this session, to give you tricky questions. The purpose of these sessions is to really give us an opportunity to dive into the domains and really just have a chance to sort of touch and feel each one of the domains. I will say that a really important part of this series is the study hall component, where you're going to have a chance to really do more hands-on practice of questions. But today we covered both domain 3 and domain 4. Would love to hear any thoughts or questions that you still have on domain 3 or domain 4.
And Dorothy, can you stop sharing?
I sure can.
You can see everybody. Folks, if you have the opportunity to be able to come on camera, those of you who can and are willing to, that'd be great. But looking for any questions or thoughts that you all have at this point about these two domains. And
thank you, Melissa.
Thank you, Melissa. And Angelica, I'm wondering, do you have the study handout that you can share, or Amber, do you have that study handout that you can share? I was looking for it. I thought I had it set up.
Yeah, sure, I can share that.
I love that.
And I do want to, so Nora is, she wants some tricky questions. Okay, so I'll make some trickier questions in the third session. But I'm going to say, please go to the study halls, because that's where you're really going to be able to have an opportunity for the application of the questions, period. This is really an opportunity to talk about what's in the domains as well.
And Ben, I thought I had responded to your question in reference to the 4 C's of collaboration earlier. You have communication, then coordination, then cooperation, then collaboration are those
Thank you.
4.
Yeah, I missed it. I'm sorry. Thank you. I appreciate it.
No worries. That chat was going fast and furious.
And I missed it completely, Ben, so I apologize.
I got it. Angelica, do you have the document?
Yes, I do. I'm not sure exactly. I'm trying to figure out how to add it as a downloadable document to the link. It's not letting me in the chat. So give me 1 second and I'll add it in as soon as I can.
No problem.
Hey, Angelica, you can't add it in the chat. So
I didn't think so. Yeah.
Yep. So I'll send it post webinar, but if you can share it right now, I think Carlton, is that what you wanted?
Yeah, I just
to share it. Yeah. So if you can just share your screen right now, that'd be great.
Yeah, sure, I can do that.
Thank you, Angelica.
Let me open that up.
And so folks, so we're having a number of conversations with folks that are preparing to take the CPS exam, and one of the things that became a bit of a theme in those conversations is just in addition to the content that's relevant to each of the domain areas and the knowledge about that, is this idea of being anxious about taking a test, right? And I would just simply share with you that I absolutely understand and empathize with those kind of concerns and feelings. I will share one really quick story. I had recently moved from Virginia to Nevada. And in the midst of doing that, when I went to, because we have these wonderful things like we have to get new IDs and all of that kind of stuff. When I went to get my license exchange, I found out that I had to take the test again. I didn't know that I would have to do that. They told me that at the time that I went to get my license. And I just will share with you that I went into that testing room after driving for all the years that I've been driving. And I'm here to let you folks know. I'm trying to keep it together. I'm here to let you know. After all these years, I sweated and I actually failed that test. Yes, I did. Yes, I see your face. Keep it together, folks. Keep it together. Don't you talk about me. I failed that daggone test. They ask me stupid questions like, how old do you have to be when you're driving the back of a pickup? I don't drive a pickup truck. I don't know that answer. Just crazy kinds of things. My point being is that when I walked out of that test, the woman gave me the book for me to study. And she said, you just need to read and study the book. Even after all of my years of driving and just how confident and comfortable I was with respect to that, the test requires certain things that the test required. And I had to go through it, and it was all the going and the manipulation of doing the test on the computer and all of that stuff. I went back, and I'm here to let you know that I went back and I aced that bad boy. I got every question right, all of that. And I'm just simply sharing that part of that was because there were certain things that I had to take into consideration that had absolutely nothing to do with the actual content, had more to do with myself, more to do with making sure that I was able to prepare well before the exam, I had to be conscious about the way that I actually treated myself during the exam, taking deep breaths, making sure that I read through every question, making sure that I paid attention to the answers, and even kind of having a sense of confidence in doing that, right? And so I'm simply sharing this, that we're offering this tool that Angelica, I just really wanted to shout her out. She pulled this information together for us. And while a lot of the information here may seem very, very straightforward, can I tell you, based upon the experience that I just related to you, I'm just sharing my own personal experience, that these concepts and these ideas are really very, very relevant when we are actually thinking about taking a test. And for those of us who you all can see the color of the hair on my chin, I'm just saying that for some of us, testing ain't our thing. I'm just saying that. Just taking the time to prepare for that. I think these tools are helpful. They come from times they were pulled out just for those of us who were kind of going through this process. And so, Angelica, I don't want to put you on the spot at all, but I did want to really acknowledge the work that you did in pulling this together. Is there anything else that you'd like to share with respect to this this tool and kind of when you began to kind of look at this?
So thank you so much, Carlton. I enjoyed looking into this for you because, like he said, when we were hearing people speak out, there was a lot of talk about the test taking anxieties and just overall in general. And so I tried to pull things here in this document that are specific for the exam that we were talking about based on the sort of concerns that we had heard. So yeah, I tried to separate it out for you guys so that you had things to think about and consider before, during, and even after your exam. And I hope that it's a little bit of a help, but thank you.
Thank you so much, Angelica. And thank you all. We look forward to the next session.